afternoon. I appreciate you joining us today regarding this emergency situation. I am Dr. Luanne Metz, MLA for Calgary Varsity and the Alberta NDP Critic for Emergency and Surgical Care. I'm joined here today by Jaelene Tweedle, who many of you know ran an incredible campaign to be the MLA for Red Deer North in the 2023 election campaign, and who has been a long-time community champion and volunteer. And in fact, it was Jaelene's brave decision to come forward and demand better health care that led us to today's news conference. We are gathered on the traditional territory of Treaty 6 and Treaty 7. Jaelene arrived at Red Deer Hospital at 3:30 a.m. on December 21st and waited 5 hours in the emergency room, and then she realized that that was not even the eventual place where she would be assessed. I realize that many of you do not even think that this wait is unusual these days. But while that was not remotely ideal, it was the scene where she was eventually moved into the actual treatment space that made it clear how overburdened the emergency department had become. The staff at the hospital had been forced to resort to hanging tarps with duct tape to create more emergency room assessment spaces. Jaelene was ushered to a space created by the tarps. It was about 1.8 by 1.8 meters in size. She sat with another patient and waited further for the only doctor working that night. At least she was told there was just one physician working. The tarps were held up by duct tape. That's what it has come to here in Red Deer, a city that has long been ignored by the UCP when it comes to public health care. Both UCP MLAs, Adriana LaGrange and Jason Steffen, stood in the lobby of the Red Deer Hospital back in 2020 and promised construction on a massive and long-awaited expansion that would begin in 2021. It did not. Then Danielle Smith appointed LaGrange the health minister, and the people of this city again hoped that would lead to good news for their much-needed hospital. But it wasn't even mentioned in the mandate letter that was given to her back in July. Since then, the UCP has gone silent. No hospital, no plan to build the hospital, not even a commitment to build the hospital. And now we have this, duct tape and tarps being used in place of a proper healthcare center. This isn't right. Now, officials with Alberta Health Services have said that more permanent partitions are being brought in and set up in the weeks ahead. But that's not a long-term solution, not even close. So today, we're here to demand the following: that Adriana LaGrange come forward and apologize on behalf of her government for failing her own constituents so badly while she is serving as the health minister. And when she issues that apology, we're also demanding she come forward with a real plan and a timeline and funding to build the Red Deer Hospital expansion. No more excuses and no more delays. Even then, that expansion will take years to complete. So we're also demanding a better solution to expand space in the emergency room. Could we create a more permanent emergency space within the hospital? Will we focus on prevention to reduce the load on our emergency departments? We should actually be supporting primary care, not just repeatedly promising to do so. We should be preventing respiratory illness. A proper immunization campaign would go a long way. This should include RSV immunization in some cases. Other measures, such as ensuring proper ventilation in places where infections spread, like schools, and using data to implement mask requirements when needed in hospitals and congregate living facilities. We should also be supporting those without homes and those with mental health and addictions, so they do not need emergency departments. Harm reduction also means reducing the use of healthcare resources. We need to look upstream. This means looking at why there are so many people needing our emergency departments. These are all options that need to be explored, and the minister needs to be transparent and accountable on all actions taken to address this crisis. And this crisis goes well beyond the Red Deer Emergency Room and Red Deer in general. There is a province-wide shortage of doctors, nurses, paramedics, and other frontline healthcare workers. There is a serious lack of support for the frontline workers that we do have. And there are virtually no public health measures to reduce the serious impact of respiratory illness. And there is little being said or done by this government beyond a move towards privatization and further chaos, possibly through the layoff of nurses. Danielle Smith promised 15 months ago to end the crisis in healthcare. She's done nothing of the sort. And in Red Deer, public health care has gotten so bad that it now involves tarps held up by duct tape. This is completely unacceptable. Thank you, and I will now turn things over to Jaelene to say a few words.
Thank you, Luanne, and thank you for coming out here immediately to help raise further concerns about this devastating situation. Public health care must be there for every Albertan, and it's simply not there for people in Red Deer. The availability of it seems to be growing even more uncertain for Red Deer residents and the hundreds of thousands of others who rely on the Red Deer Regional Hospital. Trips to an emergency room are usually a last resort and come with added stress and uncertainty. And to see our frontline staff and patients working in and being treated under conditions that are nowhere near optimal was concerning. Assessment and treatment spaces in an emergency room created using tarps and duct tape. That's what I observed, as if it was something out of a Hollywood movie set during a pandemic. As I was being taken by a porter to receive a CT scan, I had noticed the many stretchers lined up in hallways with patients waiting to receive various testing procedures. I commented to her that I was sorry to see how packed they seemed to be, and she responded, "This just seems to be the way things are now." My heart goes out to the frontline staff for all they're doing. My heart goes out to the patients that have been affected and experienced what I did in the emergency room. A doctor informed the patient who was sitting next to me that there were patients in other wards of the hospital whose own procedures had been delayed due to a lack of staff. And a friend of mine was admitted to the Red Deer Regional Hospital 2 days ago after presenting an ER and requires an MRI. But we don't currently have a functioning MRI in the hospital, so she is due to be transported to Calgary or Edmonton, hopefully today, to get the procedure done. That's right, a full-size city, and one of the busiest emergency rooms in the entire province, unable to perform an ER. How does it get this bad? I can't help but wonder if this government is blind to the conditions we're experiencing, or if they are willfully choosing to look the other way. But I do believe the Alberta NDP does care. And so I again want to thank Luanne for coming here today and making these critical calls for action. The people of Red Deer deserve public health care.
Thank you, Jaelene. I couldn't agree with you more. With that, we're happy to take any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9 to get in the question queue. Please state your name and outlet and if you who you'd like to direct your question to, and we'll just check if there's any questions in the room first. Okay, we'll go to the phones. Jennifer, your line should be open.
The audio's cutting out. Can you hear me all right?
Yeah.
I'm not sure if you can hear me. My question is for Jaelene.
Go ahead, Jennifer, we can hear
I was
you.
wondering, when you were in the hospital as a patient, I guess, what was going through your mind when you saw sort of what was going on in the ER and that these tarps had been hung? Can you just give me a sense of sort of what you were thinking when you witnessed this?
I was surprised to see things had come to this. I had known and I'd heard, I know people that work within the healthcare field that our ER has been under a lot of stress. I was not prepared for what I saw though, and my thoughts were about the people who are waiting sometimes much longer than they need to be for potentially critical issues, and our staff. I cannot say enough about how wonderful and amazing our staff is at the hospital, and they are going above and beyond in conditions that they shouldn't have to work in nor provide care in.
Do you have a follow-up, Jennifer?
I do, thanks. I hope you can hear me all right. I guess, can you describe how busy it was? You said I think you waited about 5 hours. Can you just kind of go over that for me, what that experience was like?
So when I went in at 3:30, I felt grateful to see at least the waiting room outside of the ER treatment facility was actually quite quiet. And there was patients that were going up to ask the nurse working on triage why they weren't getting in, why the wait was so long, when it seemed to be a quiet night. And she had said, you know, there's things going on in the back that you can't see here. And it was clear once I got to the back what it was. There was no space for patients. In the probably about close to 7 hours I spent back in the treatment part of emergency, I had a patient come by and chat with the lady sitting next to me who had come in for other treatment, and they had seen each other in the ER a couple days before, and this patient had commented that she had been sitting in the ER for 3 days now in a cubicle that she said at least they've brought in a recliner for me to sit now, waiting to be admitted to a bed upstairs. Because there were no beds to put patients in. So our ER is housing people that already have been admitted, but there is no space for them on our wards.
Thank you. Jennifer, we'll just now go do one more. Oh, here we go. Sheldon, your line should be open.
Okay, thanks very much, Jaelene. I hope you're feeling better now.
Thank you, Sheldon.
You're welcome. You guys mentioned that today is about a call to action on the government and the health minister in particular. You mentioned that you guys would like to see more details in regards to a plan and a timeline and funding for hospital expansion here in Red Deer. What would the NDP say is our realistic funding announcements that the government could make at this point in time, and a timeline, and what kind of plans, if the roles were reversed, if the NDP were government right now, what kind of plan or timeline or funding do you think the NDP could provide at this point in time in regards to this project?
Well, we know that an expansion is going to take a few years, but what we need is a commitment of the funding to get the planning done, and a commitment that they will move forward within probably be 2-3 years that we would have the space open, but we need to know that they're not just announcing it again, that they're putting the dollars behind it and committing.
Right, okay. I have a follow-up, if that's all right.
Yes.
Yeah, okay. You guys also mentioned, pardon me, you'd like to see a better solution to expanding emergency room space as opposed to tarps and duct tape, of course. Does the NDP have some possible solutions instead of that at this time?
Well, there's two things. One is you have to look, it has to be done by the people that work within the facility who are going to know what might be movable somewhere else. I mean, in the Red Deer Hospital, there's not a lot of space. That's why we need the expansion. But we have to look at whether there's possibilities that some of the facilities might be reasonably moved out of the hospital. And we want to be sure that we're not using hospital spaces for anything that could be done elsewhere, such as maybe some of the inpatient beds might hold patients. We don't have the details because we can't get access to this, but maybe some of the inpatient beds are for people that could be somewhere else. And we want to assure that that testing is available there. I mean, not having an MRI scanner that's operational blocks things up. More people are going to be staying in spaces waiting for scans as they're inpatients. But even more important is that we have to reduce the burden on the emergency department, not just in Red Deer, but everywhere. And that is what we call harm reduction. It doesn't only apply to use of opioids. Harm reduction is getting vaccinated. And we saw that this government blocked the campaign and the use of the proper wording to encourage people to get vaccinated. So part of the burden on this and other emergency departments is because we're not doing the preventive measures that we need.
Thank you, Sheldon.
And just for clarity, that was Luanne that answered both my questions, correct?
Yes, it was.
Yes, okay, I just want to make sure. Thanks
Thank
very
you.
much, guys. I appreciate that.
Thanks, Sheldon. So we'll just do one more quick pass for questions. If you're on the phone, it's *9. If you're on Zoom, it's raise hand. Yep. We have a question in the room here.
Susan Zielinski at the Red Deer Advocate. I was just wondering if you're worried about what else might be happening in the hospital that we're not even aware of.
Well, there are pretty common situations happening in most of the major hospitals that we're kind of aware of, but we don't have data on. I mean, at the first step, there's the people that are brought in by ambulance, and there's long wait times for them to what we call offload patients. They've changed the definitions of what they measure now, so we really don't have good data on this. They used to count the offload time from the time the ambulance arrives at the emergency department. Now they start that time clock when they're first triaged, and that can be a very long period of time. Just like Jaelene experienced, 5 hours sitting there. Ambulances can be there quite a long time as well. The second thing is that we don't have a count. We know the numbers are there, but we don't get any reporting of patients that are admitted but staying in the emergency department. And what that does is it not only blocks space, assessment space for people that come in, but it also takes the staff time away to be providing basically inpatient care. And of course, for the patients, it's horrible. They could be in a hallway. You can imagine on a stretcher in a hallway vomiting as people walk and rush past you. It's a horrible experience. We also know that that can lead to bad outcomes. An elderly person that sits in the emergency department is more likely to get delirium, which then if they're waiting there for whatever reason, maybe a broken hip, and they're waiting hours and hours, and then what will happen is that their stay is extended. So by keeping people in the emergency department, they're having a bad outcome, a bad experience. We're using up more hospital resources because of this. And people don't always recover back 100% when they get a delirium. So we're adding another burden of illness to people. Then when you get into the hospital rooms, you've got problems where people are in spaces that weren't designed as hospital rooms. And I don't know what's going on in Red Deer, but I do know this happens in most other hospitals, where people might be in the hallway of a unit, they're not in a room, or they're in a bed called an overcapacity bed, which might be what was once, a long time ago, a lounge, and now it's turned into a place with some curtains. They've actually used them so much in the last few years that we have rails on the ceiling and curtains in there. There's no bathroom that's associated with those rooms, and there's very little privacy. And so we've got all of these other spaces being taken up. And then because of lack of resources to get things done, a lot of the time when people are in hospital, it's not just getting the treatment they need, they're waiting for the treatment they need. And that can be days or longer. And therefore, everything gets bunged up and we use much more space. We don't know because the numbers aren't publicly reported, but this is kind of routine. It's not a one-of, it's every day in every hospital, every of the big city hospitals. And so we know that things are in a very bad state. So trying to get people through the emergency is getting harder and harder, and our staff are getting burned out.
So what should people do when they encounter problems at their hospital?
They're always happy to let me know. I would say they should email the health minister so she's aware, and copy me as the critic for emergency and surgical care, just at my assembly email address. I think we need to know what's going on, and we need to push this government to be transparent. We can't show improvements that they keep promising if we don't start collecting the data.
Great. Thank you, everyone. That concludes our press conference for today.